So this is the third presentation about COVID and schools since the opening of schools on March the 8th. This is from the 26th of March, but the data is largely for the first 2 weeks of school opening because it always comes that bit late. On this slide, we present the total amount of COVID for all age groups across the last few months. And you can see that cases began declining with the lockdown around January. That decline has now leveled off. We will wait to see what happens as we go forward. You can see that the pattern is the same in all of the home nations, but that there is an increasing case rate in Scotland currently. You can also see that we have the same situation in the English regions, all more or less at the same level, but that red line is going up quite steeply in Yorkshire and Humber, and there is an increase on the purple line in the West Midlands. It'll be important to see what happens to cases in the different regions over time. When you look at school age pupils, you can see that the red line for secondary age pupils has started to increase. This is from the coronavirus infection survey, so it's not based on how many tests are done, it's a random sample of the population that is tested. The blue line for primary pupils is still more or less level. When you look at the total age range for all ages, you can see that the school age groups are now slightly above the all age group. Lateral flow tests have gone up dramatically since schools opened on the 8th of March. And at the right hand side of this chart, you can see that there are still lots of lateral flow tests being conducted, even when they weren't conducted in school. So the largest of those bars is on a Sunday, and that shows that many parents have been conducting the lateral flow tests either with their children or on themselves if they're primary age parents. Those lateral flow tests are showing more positive tests, and you can see that towards the right hand side of this graph. However, it's quite difficult to disentangle how much of this is because of the increase in cases among secondary age pupils that we saw a little earlier, and how much is because there is so much more testing going on, and we'll have to wait and see that data over a little while longer yet. Hospitalisation is still falling dramatically, and that's because cases fell a little while ago. Deaths are also falling dramatically, again because cases fell that little while ago. The progress of vaccination will be starting to have an effect, but we're told that it's mainly the fact that cases fell a few weeks ago that's leading to that at the moment. School attendance has leveled off, with schools, the red line there for secondary schools showing that they opened on Monday the 8th with around 30% of pupils in, and are now at 90%. That's lower than normal. Normal attendance is 95%, but we're at 90% attendance in secondary schools. 2% of pupils were absent last week because of coronavirus. 7,000 of those children had a positive case for coronavirus confirmed by a test. 21,000 had symptoms, but we haven't yet got the confirmation of whether they had COVID or not. And 169,000 were self-isolating. About half of those were sent home because they were close contacts of someone at school, and about half had been close contacts of someone at home. 4,000 children were off because their school was closed. That's not very many schools, but 4,000 because their school was closed. We can see an increase in the number of outbreaks in schools. Now, an outbreak means 2 or more cases, so it doesn't have to be a big outbreak to get onto this list. And you can see here, that green bar represents 53 primary schools that had an outbreak. That's out of 13,000 schools. The yellow bar is 19 secondary schools out of 4,000 had an outbreak, 2 or more cases. Of course, what we're all hoping is that vaccination will be the saviour and get us through this. This chart on vaccination shows that a huge number of 70-year-olds and above have now had their vaccination. It's 99%. And amongst 50 to 69-year-olds, it's now 79% have been vaccinated. When you add those who have an appointment, it's 95%. So that is still very good progress on vaccination. The reasons people thought they might not be able to get vaccinated, there was more worry and less in the experience. So about 5% of people said they thought they'd find it difficult to travel to get the vaccine. It turned out to be 2%. 6% of people anticipated a very long wait at the GP or the vaccination centre. It turned out only to be 2% of people who thought there was a long wait when they actually went. 3% of people thought they might have difficulty taking time off work. Actually, practically nobody reported that. So if you do have difficulty in your school with getting time off, know that that's a pretty unique situation and do ask your head to reconsider. The NEU is continuing to maintain its COVID map, which shows these relatively flat in most of the country and will be picking up the increases in the regions I mentioned previously. And we are continuing to have our health and safety advice and our education recovery plan advice on our website. We will keep reporting on what's happening to cases and whether we see an increase in the overall cases and then an increase in negative consequences. It may well be that the Easter close down will suppress cases and that vaccination will stop hospitalisations and deaths rising. That's what we're all hoping for. Check in back here to see what we're actually seeing on the data as we go through these weeks. Thanks for listening.